Well, hundreds of junior doctors say they are in limbo tonight over their mandatory one-year community service placements. They have to complete this before they can practice as medical doctors. Medical interns say they are frustrated because the delays impact making preparations for things like where they will live. Some have to take their children out of school. Some have to relocate their families if they are placed in provinces for which they did not apply. Employed Doctors Advocacy Forum Chair Dr. Akhtar Hussain joins us now to explain their plight. Dr. Hussain, good evening and welcome to you. Thank you for your time. Well, as I mentioned in the intro, hearing about hundreds of unplaced junior doctors, share their plight and what you're seeing from your perspective.
Thank you very much for having me in SABC and the listener. Yes, this is a big concern. It's a very stressful situation for our junior doctors. Those doctors already done 2-year internship. They're about to finish end of December, and they're supposed to go and start community service. The delay of placement for community service by the Department of Health and the ICSP intern community service placement system, which is working very slow, very poorly done allocation, and they haven't got their choice. There are 5 choices supposed to be given to each medical officer or interns to apply, 2 in the province and 2 outside of the province. And some of them haven't got their any choice. They have been just placed anywhere the department like. And now the problem is they got a family, some of them got children. They didn't get that placement according to their choice. Some of them married. Now the married couples are separated. Social compact requirement was not fulfilled. And it's a desperate situation for our junior doctor. The allocation came last week, very few placed. Then another batch came placed. So as a medical association South Africa, we make sure every intern, every community service need to be placed because it's a mandatory. It's a professional act, 56 of 1974, training must be given.
Right. Just a quick one. Sorry, Dr. Hussain, to come in there. So much to get through, so little time. Just when was the deadline for those placements? I mean, typically, when should this have happened? I mean, how many months ago?
This has happened last week. They're supposed to be placed, everyone supposed to be placed by September, October. In fact, we are demanding this placement, especially for community service. You don't need, they are already in the system. They got a government parcel system. So they need to be placed anytime June, July.
Right.
So there are no confusion, no, the hassle there. Because they need to find now accommodation. Public sector, they don't provide accommodation for community service doctors. And they need to have a safety place. And they need their children to be in schooling. So those, and then also they need a leave, relocation leave. They are no such a thing provided.
Okay. These are really complex issues you're sharing with us. So already this deadline has lapsed and people are in limbo. Who is directly responsible for the placements? We know that there's an internship community service program website. That's the platform that's used for placements. We understand it's reportedly been down for those people who have gone to check. But importantly, the placement process is not happening timeously nor uniformly. But who is directly responsible? Is it a combination of the department and the HSPCA? Who's dropped the ball here?
No, it's not. Thank you. It's a very important question. There's nothing to do with the Health Professional Council. This is totally solely responsible Department of Health, Minister of Health. The hospital open and closing is the responsibility of the Minister of Health. So the allocation, the placement, the budgeting, the allocation of the community service and the after community service, the placement is also responsibility of National Department of Health, Provincial Department of Health, which is not happening. It's a year after year, year after year. In fact, some of the year the placement comes just before one Christmas Eve or Christmas Day. So that is not acceptable. And we requesting our member, if they haven't got placement, must contact South African Medical Association, those who are applied and still didn't get the placement, and those who wanted to swap or exchange their placement, mutual exchange or try. They must contact South African Medical Association. We are working with the Department of Health, and it's a responsibility of Department of Health, national, to make sure they get placed in time.
Well, thank you so much for that clarity. That was Employed Doctors Advocacy Forum Chair Dr. Akhtar Hussain.